The medical community is raising urgent alarms over a terrifying new threat, a drug-resistant, sexually transmitted fungal infection that is spreading at an alarming rate. Trichophyton mentagrophytes type 7, TMVI, a highly contagious and aggressive fungal strain, is infecting people through intimate contact, leaving victims with painful, treatment-resistant skin lesions that can persist for weeks or even months. Health authorities worldwide are struggling to contain the spread. And the worst part is that this could be just the beginning. If this infection continues to evolve, the world could face an untreatable epidemic, leading to widespread suffering and permanent health consequences for thousands, if not millions, of people. This so-called genital superfungus was first reported in Switzerland in 2014 and has since spread rapidly across Europe, North America, and beyond. Cases have been documented in Germany, France, the United States, and most recently, Greece, where doctors treated a man suffering from a severe and unrelenting rash in his genital and abdominal region. In the U.S., the first confirmed sexually transmitted case was reported last year in New York, with additional cases surfacing soon after. Health officials are deeply concerned that the infection is already far more widespread than reported, largely due to the delayed onset of symptoms and the lack of public awareness. What makes TMVI so dangerous is its ability to resist standard antifungal treatments, rendering many conventional medications useless. Patients infected with this fungus have undergone weeks of ineffective treatment before finally being prescribed high-dose antifungal drugs, which are among the most potent available. Even then, the healing process is slow, and in some cases, complete eradication of the infection remains uncertain. The risk of permanent scarring and skin damage is significant, leaving survivors with lasting physical and psychological effects. The possibility of the infection becoming truly incurable is a looming nightmare, one that could have devastating consequences for global public health. Despite these terrifying realities, the public remains largely unaware of the dangers. Many people mistake TMVI for common skin conditions like eczema or standard ringworm, leading to misdiagnosis, improper treatment, and further transmission. Because lab tests to confirm the presence of TMVI can take up to 3 weeks, infected individuals may unknowingly spread the fungus to multiple partners before even realizing they are carrying it. With lengthy delays in diagnosis, combined with long waiting lists for dermatology appointments in many countries, the potential for unchecked spread is enormous. This crisis is not just a theoretical concern. It is already happening, and the medical community is struggling to keep up. Experts are urging doctors to be more vigilant in recognizing TMVI, but there is a growing fear that undiagnosed cases are already circulating, particularly in regions where STI testing is not routine. The fact that some of the earliest cases were linked to travel in Southeast Asia raises concerns that international travel and tourism could be fueling the infection spread. If more countries begin reporting outbreaks, the world could be on the verge of a full-scale public health emergency. Governments and health agencies must act immediately to raise awareness, improve diagnostic testing, and invest in the development of new treatments before this infection spirals further out of control. The rapid increase in drug-resistant fungal infections is a direct consequence of overuse and misuse of antifungal medications in both medical and agricultural settings. If no action is taken, TMVI could become just one of many unstoppable fungal infections threatening global health. The public cannot afford to be complacent. Anyone experiencing unexplained rashes, particularly in the genital or abdominal areas, must seek medical attention immediately and request thorough testing. Delaying treatment or assuming that a minor rash will go away on its own could lead to weeks or months of unnecessary suffering and contribute to the further spread of the infection. More importantly, practicing safe sex and maintaining good hygiene are crucial in preventing transmission. While TMVI is not yet widely known, its potential impact is too severe to ignore. The world has already seen how rapidly an infectious disease can spread when warning signs are ignored. With TMVI, there is still time to contain the outbreak, but only if the seriousness of the situation is acknowledged now. If action is not taken, The consequences could be disastrous. The medical community is on high alert, but the public must be as well. Ignoring this growing threat could lead to a future where TMVI and other resistant fungi become a permanent, untreatable fixture of global health. This is not just another infection. This is a warning.